Hello. Thank you very much for inviting me to be a part of this series. My name is Dr. Steve Kruzeniski. I am a veterinarian living in the Sacred Valley of Peru. I am also a student of transpersonal psychology, indigenous wisdom, psychedelic assisted therapy, One Health, and human support. I am a coach and trainer for students from around the world. I am also a photographer, fascinated at viewing the interconnections between humans, animals, and our sacred ecosystems which sustain us all. For the past decade, I've had the opportunity to lead groups of veterinary professionals into remote geographic locations to provide needed veterinary services. This often consisted of sterilization procedures, wellness services, and education. I had such incredible privilege to be able to visit and collaborate with communities around the world, and I learned a lot within that process. While the majority of time we were able to celebrate the good work that was being accomplished, there were definitely moments of conflict that arose between managing volunteer and local partners. One of the most difficult areas to navigate was suffering and euthanasia. Bringing together different cultures, religious beliefs, and politics created situations where not everyone agreed. As a veterinarian leading a team, but also a guest in a foreign country and partner on a project, this made for unique situations that were not easy to navigate. To this day, I look back on some events and wish I had handled it differently. A common result of navigating ethical dilemmas, especially working in non-ideal situations. Ethical dilemmas surrounding euthanasia are high in veterinary medicine. Factors related to money, conflicting beliefs, and legal ownership can be very stressful for the clinician and are often not properly explored in foundational education. The impact on the clinician can be great, and one should cultivate self-care and awareness when confronted with these difficult situations. Here I will present to you some of these ethical conflicts that are commonly witnessed by clinical practitioners around the world, and bring in some of the unique challenges that can arise when confronted with euthanasia in the field. I remember, in the beginning of my career, I did not feel prepared for performing euthanasia. I do not remember it discussed much in my veterinary curriculum. It was an accepted part of the profession and even discussed as an option of care, but the actual practical and philosophical aspects of euthanasia were never thoroughly explored. In practice, you learn to navigate this in time, ideally with mentorship. Every patient is different. Every client is different. Every practice is different, and you are left to lead the navigation of a complex and often emotionally demanding aspect of our profession. As you listen to this presentation, please keep in mind that much of this is my own opinion. I am no expert on this topic, but I do believe my work in different countries and with different teams provided me with a valuable perspective. As my relationship to this topic has already changed throughout my career, I expect that to continue. I believe, as with any moral or ethical dilemmas, we are only working within the systems and known information that is available to us at that time. What has been relevant to me in my career may not be right for you in your practice. I believe, in the end, this is a highly personal topic, and you must first understand and even continually challenge your current beliefs in practice. While throughout this presentation I hope to present various angles without giving too much of my own beliefs, I do agree with the statement made by Marcella Rubeletto that by no means a veterinarian must be coerced into proceeding to euthanasia of a healthy animal on basis of social or convenience reasons, even though pets may be considered as a legal property of their owners. So let us move on to some definitions regarding euthanasia. The term euthanasia comes from combining the Greek words eu, meaning good, and thanatos, meaning death. In human practice, this may be alternatively defined as mercy killing, when death is a welcome relief from a life that has become too painful or no longer worth living. Although illegal in most parts of the world, medical euthanasia has become an accepted practice in some countries. A practice that appears to be very carefully navigated, but also has the advantage of patient consent in ideal situations. Patient awareness and communication may help to navigate the more subjective aspects of suffering and quality of life that the veterinary profession is left to determine on behalf of the patient. In veterinary medicine, the term euthanasia appears to contain a much broader definition. The practice of euthanasia is extended beyond mercy killing and is elected for owner convenience, for reasons of overpopulation, for behavior problems, or as donors of tissue for research. In contrast with humans, euthanasia of an animal cannot always be said to be taken within the animal's best interest, which in itself may be impossible to fully determine. Non-human animals are non-autonomous patients and thereby cannot give consent. The final decision may be left to the attending veterinarian and typically made in partnership with the owner of the animal. In cases such as animal epidemics or overpopulation, decisions to perform euthanasia en masse extends beyond a clinic scale and into the realms of public health. So it appears one common definition may not be possible within veterinary medicine, and a broader definition may be needed or even seen on a contextual basis. At a base, euthanasia of an animal equates to killing in the animal's interest or in the interest of its owners. This is ideally performed by a veterinarian with a method that avoids pain and distress. In these definitions, the reasons or the justification of the action are not considered at all, and so we need to further navigate. A euthanasia may be deemed ethically justifiable when a veterinarian is acting within the best interests of the animal, owner, or public as far as they can determine with the information provided. The main intent is to reduce suffering of the individual animal in a situation where it appears no remedy can be achieved. Or, for some, euthanasia of an individual or group of animals whose disease process poses a risk to a larger population and whose killing will reduce that risk. It needs to be mentioned that there are belief systems that do not think any form of animal euthanasia is considered ethical and that no human has the right to make that decision. A euthanasia may also be considered ethically unjustifiable. This is a much more difficult category to define as it is going to have a personal relation and therefore by its nature creates conflict. For some, this may be when an owner wishes do not correlate with the best interests of the animal. This may be seen in the form of a convenience euthanasia. An example for myself was when I was asked to euthanize a cat early in my career. The owner had passed and the cat was now in the care of another. The new caregiver described pain and suffering of the patient but refused any diagnostics and elected euthanasia, despite my efforts. It was only after the procedure was complete that the caregiver informed me it was the owner's wish, who had recently passed, to be buried with her cat. This is a case that sticks with me to this day, and for me was ethically unjustifiable, and something I was not prepared to properly navigate at the time. A euthanasia may also be deemed contextually ethically justifiable when the animal could have a life worth living in an ideal world, but the circumstances meant that opportunity is not worthwhile. This is a large gray area where a veterinarian may have to grapple with making a decision in an unideal situation. This came up frequently in the field when providing service in remote locations. Maybe a specific patient could be treated, but often with no one to provide long-term care, euthanasia may become the patient's best option to eliminate pain and suffering. These are the tightrope cases where one needs to balance animal, owner, and public interest. As with all healers, veterinarians are faced with ethical dilemmas and face their own ethical vulnerabilities. Euthanasia is one of the most frequently mentioned challenging or problematic situations in a small animal practice. So, as a starting point, it is important to make space for understanding your own beliefs. What do you think about euthanasia? When is it appropriate? When is it not? Do you take an animal-centered approach? Do you take an owner-centered approach? Does this change with different species? Will you be rigid or flexible in your beliefs based on the situation? You will be challenged with weighing all the perspectives and often put in the position to make the final decision in what can be an extremely complex situation. In many parts of the world, euthanasia is an accepted and welcome practice in veterinary medicine, given the circumstances deemed it appropriate. For example, in cases of terminal illness and extensive suffering where no cure can be realized. In a standard clinical setting, this decision is typically made in guidance with a veterinarian who assumes the responsibility of determining the extent of the animal's illness and gauging prognosis. It is the veterinarian's responsibility to gather and communicate this information to the owners in a clear and compassionate manner. In many countries, it is ultimately the decision of the owner as to whether euthanasia is performed. The owner may be in agreement or disagreement with the veterinarian, creating a platform for ethical dilemmas. If in agreement, the veterinarian has a duty to perform the euthanasia in the most humane manner possible. Disagreement between client and veterinarian services in a couple different ways. First, if the veterinarian assesses euthanasia to be inappropriate, but the owner continues to request in cases of financial restrictions, behavioral problems, convenience, or apparent suffering, the veterinarian then has to make a decision on how to proceed. I have found myself in situations that, with time and persistence, I was able to help navigate the client away from euthanasia when I found it inappropriate. Other times I was not successful. It then became a decision whether to respect the wishes of the owner or to turn away. This may come down to the individual veterinarian's beliefs or even their employers. A very common dilemma between practitioners and their employers is centered around autonomous decisions related to euthanasia. I recommend discussing these types of cases and policies with your employer early in a hiring process. The second category of euthanasia dilemma is when the veterinarian may deem euthanasia appropriate or even necessary and the client disagrees. As the primary patient advocate, the veterinarian is expected to clearly communicate when they believe euthanasia is the best decision in a particular case. Assessing quality of life is subjective and has been described by Macmillan as a multidimensional array of affective states, in that it refers to a state of mind resulting from the balance between comfort, discomfort, and pleasant and unpleasant feelings. The final decision typically falls on the owner with the veterinarian's input. Navigating these cases brings about the same challenges and can be very distressing for the clinician. Situations that have a very poor prognosis and, despite your best efforts, result in the continued suffering of your patient. It should be noted that you are often working in a team. While the decisions may be of the veterinarians and owners, conflict may arise between clinic teams who disagree. It is best to hold space for discussion of these difficult cases, ideally with a veterinary social worker if present. If not, these discussions may be left to a practice manager or the veterinarian in charge. Unresolved conflicts create fractures within a workplace. The whole team may not always agree in the end, but I urge you to create a platform where all voices can be heard when it is found to be most appropriate. This may be before a procedure is performed or after in the form of decompression and case review. Unfortunately, you will likely be presented with euthanasia ethical dilemmas where you feel there is no right decision to be made. These are difficult situations, but may be unavoidable. On top of that, the situation may become emergent, where a decision needs to be reached quickly without the opportunity to gather all the information. But in an ideal situation, here are some recommendations to assist you in this process. The first is to listen. I believe the cultivation of good listening skills are vital for clinical veterinarians. Do your best to thoroughly listen and empathize with all involved. This will include, at a minimum, the owner or client. Listen to your patient in this context refers to doing what you can to gather information for their diagnosis and prognosis. If you can, take your time in making a decision. Morgan and McDonald stated that hasty decisions in morally charged situations could have long-term consequences for patients, clients, veterinarians, and the profession. This can send us into rumination and self-doubt. There have been times when the situation felt emergent and a decision needed to be reached immediately. While sometimes this is the case and the veterinarian must do what is deemed appropriate, it is also in these high-stress situations that a clear decision cannot be made. And it is more appropriate to do what one can to decrease stress and emotion, control the situation, and take time to communicate and help navigate the situation with all parties. While, of course, doing what one can to make the patient as comfortable and pain-free as possible. For me, mindfulness meditation practice has helped me with maintaining a calm, thinking mind instead of being pulled into the overwhelming emotion of the situation. And finally, how do you feel? Ultimately, you have to live with the decision that is made, and as I empathize that it will not always be a perfect situation, do know that your opinion is valid, and how you are morally and ethically moved by a situation should always be taken into a consideration. I repeat from earlier, by no means a veterinarian must be coerced into proceeding to euthanasia of a healthy animal on basis of social or convenience reasons, even though pets may be considered as legal properties of their owners. Moving from the clinic to a global field situation, there may be compounding perspectives which make complete agreement between all parties even more difficult. Beliefs vary between cultures, communities, religions, and even between individual practitioners and other team members. In these situations, to whom do you owe primary obligation? Who has the final say? The lead vet, the local vet, the owner, the community, the law, and it can go on. I believe these situations are best discussed prior to starting the clinic, or ideally when initial cooperation is developed. While one may not come across a case such as this, I feel preparedness is the best route. Having an understanding of the different views or even specific legalities in a country on euthanasia and who ultimately has the final decision is very important in creating a strong partnership. This also avoids having to have these difficult conversations in a high emotional state, which may turn out to be destructive for an ongoing relationship. This may also determine if the parties in question may decide to work together or not. While you will not be able to predetermine all potential situations, having some kind of framework in place beforehand is highly recommended. It must be noted that I am presenting this from my own lens, that of a Western education and belief system that has also been challenged over the years. There are situations where there is no clear right or wrong, or where not all parties involved will come to a consensus. All parties involved must be aware of their own biases, and in situations where one side is offering aid or assistance, this does not grant them ultimate decision. Bias, colonialism, racism, and other potential explicit or implicit prejudices may be present and serve as pressure in the form of an unbalanced power dynamic. This may become even more complex when the animal in question may be used for food by the owner or community, and then even determine what methods of euthanasia can be selected. While the situation may differ, the principles mentioned above remain the same. To the best of your ability, listen, maintain calm, and take the appropriate time to make a decision while keeping in focus the sentience of an individual patient. As stated earlier, the veterinarian has the duty to perform euthanasia in the most humane manner possible. The field often provides unique challenges in this regard, as standard euthanasia protocols may be impossible given the circumstances. It is up to the practitioner to educate themselves on a variety of techniques that are considered humane. This may include, but is not limited to, variable drug combinations, firearms or captive bolts, intrathecal drug administration, or deep anesthesia and exsanguination. Even in very difficult and limiting situation, it remains the veterinarian's responsibility to provide a quick and painless death. As a veterinarian, these situations appear unavoidable. I wish I could say I have always acted in accordance to my beliefs and feel 100% satisfied with the outcomes of these situations, but that is unfortunately not true. It is one thing to be aware of your moral beliefs and oftentimes another to uphold them. These situations are complex and can leave a practitioner navigating a very difficult situation that they end up ruminating on. This is why I find it important to address the impact euthanasia, regardless of the situation, can and will have on most practitioners and team members. I think this can show up in a couple different ways. First is moral distress, when we have negative or conflicted feelings arising out of feeling both compelled and blocked. This may show up as shame, guilt, irritability, anger, self-righteousness, hardening, rigidity, or sadness. Moral injury occurs with the betrayal or what we perceive as right. This often occurs in high-stakes situations where there is conflict with deeply held beliefs and the evaluator is unable to right the wrongs. This can also extend to bystanders or team members who may not be directly involved. Disenfranchised grief is generally grief that is not usually openly acknowledged, socially acceptable, or publicly mourned. I believe this is relevant in veterinary medicine with euthanasia and beyond. The grief we may experience for a patient, owner, or situation tends to compound within us and may lead to negative emotions or even emotional numbness for our patients, colleagues, and ourselves. How you process and practice self-care is beyond the scope of this presentation, but may include mental health support and at a minimum creating a space for reflection. This may come in the form of a team debriefing or collegial support for difficult cases, or through the use of a veterinary social worker or other professional assistance. If you or anyone you know finds themselves struggling with navigating the complex ethical dilemmas we in the veterinary profession commonly face, I highly encourage you to use the resources available to you. Communities such as Not One More Vet are a good example of a grassroots organization that is growing to support the profession across the globe. Thank you very much for listening to my presentation as I did my best to wade through these murky waters. I hope it can provide some encouragement to understand and challenge your own beliefs surrounding veterinary euthanasia on a personal, communal, and global level. If you have any questions, comments, or concerns, please feel free to contact me. Thank you.